Welcome to Health Organizers, your digestive system specialist. In our Health Bites, we strive to provide you with just enough information to chew on so that you can understand how to care for your digestive system, also known as your hole in the middle. On this edition of Health Bite, we will discuss hemorrhoids. Now, hemorrhoids are tissue that are somewhat inflamed and can at times be internal, where you really can't see them, or can be external, where you can actually see them at the exterior portion of the bottom. Then, how are we at risk for developing hemorrhoids? Particularly if one is very sedentary. So if we're seated all day long, perhaps in an office job, and we're not moving around, that can be a risk factor for developing hemorrhoids, as can constipation. So if we are straining with bowel movements, that can allow the tissue to kind of prolapse through or fall through. Also with pregnancy, there can be a lot of pressure in that lower area and again allow that tissue to kind of fall through. As far as the signs and symptoms go, you can have bleeding with bowel movements, you can have pain with bowel movements, you can again notice the tissue is outside of the anus. So those are some of the signs and the symptoms that you can have. As far as natural therapies go, we would look for the underlying cause. So if it's constipation, then we'll definitely need to look at ameliorating constipation or factors that lend to constipation, such as nutrition and supplements. If it's being too sedentary or too seated, then we can definitely incorporate more movement. So again, looking at natural therapies, it will depend on what the cause is, so be sure to contact us so that we can individually assess your own story or your case. That concludes this edition of Health Bite on hemorrhoids. Be sure to find us on the web at healthorganizers.net, to like us on Facebook and follow us on Twitter. I'm Dr. Megan LeBon, and remember, Health Organizers working with you to tidy up your health naturally.